neoMONARCH is a phase 2 randomized clinical trial in the neoadjuvant setting addressing a new therapy, abemaciclib, which is a CDK4/6 inhibitor in combination with anastrozole. Now, this study is enrolling patients who are postmenopausal with hormone receptor positive, HER2 negative breast cancer, and eligible patients are undergoing a baseline core biopsy. They're then randomized to receive anastrozole alone, the combination of abemaciclib with anastrozole, or abemaciclib alone for 2 weeks. And after 2 weeks, they undergo a second biopsy, at which point all patients then merge onto the combination therapy arm and receive 14 weeks of abemaciclib and anastrozole, at which time a third biopsy is done. So the primary endpoint is actually looking at what happens at day 14 in terms of that tumor biopsy. Does the Ki-67, or the proliferation, drop at day 15 compared to the baseline Ki-67? We know from other studies that were initiated by Mitch Dowsett that a drop in Ki-67 may be predictive of disease-free survival, so it might be a good surrogate measure of a longer-term outcome. So that was our primary endpoint. And what we showed with 161 evaluable patients for this primary endpoint is that both abemaciclib arms actually statistically significantly increased the drop, or dropped the Ki-67 more significantly when looking at the geometric mean change compared to anastrozole alone. So around 60% of patients in the anastrozole arm had a drop in their Ki-67 after 2 weeks of therapy, and it was over 90% in each of the abemaciclib-based arms. So our primary endpoint was met.